Have you ever felt tired of hearing one alarming headline after another about viruses and wondered what you are actually supposed to believe? One of my patients once shared that she stopped watching the news altogether because every news story left her more confused than informed. I want you to imagine this for a moment, sitting comfortably at home, realizing that clarity does not come from more noise, but from calmer understanding. I am Dr. Evelyn Carter, and for many years I have had the privilege of caring for older adults who value truth delivered with care. Many seniors tell me that what unsettles them most is not the virus itself, but the swirl of myths that seem to follow it everywhere. This video is not here to warn you or to add another worry to your day. It is here to slow things down and gently separate what is misunderstood from what is medically sound. When we talk about myths, we are not talking about foolishness. Myths are often beliefs shaped by fear, repeated stories, or information shared without context. The human brain, especially as we age, is sensitive to emotional overload. When fear leads the conversation, memory and judgment suffer. When calm leads, understanding improves. That is why learning the difference between myths and facts is not about arguing. It is about protecting your sense of safety and dignity. From my clinical experience, older adults process health information best when it is explained slowly and with reassurance. You should never feel rushed to react or pressured to remember every detail. Medical knowledge should serve you, not weigh you down. When facts are placed gently into context, the mind feels steadier and the body responds with less tension. That is the heart of Senior Health Daily. This channel is meant to feel like a conversation with someone who respects your pace and your life experience. If this approach feels helpful, please consider subscribing to Senior Health Daily, liking this video, and sharing it with someone you care about. Your support helps us continue creating calm and trustworthy health conversations. In the next part, we will talk about why myths about viruses spread so easily and how understanding facts can bring peace rather than pressure. Thank you for being here and for choosing understanding over fear. Why myths about viruses spread easily. Myths about viruses often spread more easily than facts because they travel on emotion rather than understanding. When people feel uncertain, the brain looks for quick explanations that feel reassuring or dramatic. This is a very human response. As we age, we become even more sensitive to emotional tone, especially when information feels urgent or confusing. A statement that sounds alarming is remembered faster than a quiet explanation, even if that explanation is more accurate. From my years in clinical care, I have seen how fear fills in gaps when context is missing. Viruses are complex, and medical language can feel distant or technical. When details are unclear, stories take their place. These stories are rarely created with harmful intent. Most begin as attempts to make sense of something unfamiliar. A partial truth is repeated, a detail is exaggerated, and soon a myth forms that feels easier to grasp than the full picture. Another reason myths spread quickly is repetition. Hearing the same idea multiple times gives the brain a sense of familiarity, and familiarity can feel like truth. This is especially important for older adults who may hear information from television, social media, or well-meaning friends. When the same message appears again and again, the brain naturally assumes it must be reliable. Without calm clarification, myths gain strength simply by being repeated. Stress also plays a role. When people are tired or emotionally overwhelmed, the brain prioritizes information that feels urgent. It has less energy to sort details or question accuracy. This does not mean someone is careless. It means the brain is protecting itself by simplifying. In these moments, a dramatic claim can feel more believable than a careful explanation. I often tell my patients that myths thrive when conversations move too fast. Facts require patience. They ask us to slow down, to listen, and to hold more than one idea at a time. Myths offer quick certainty. They tell a simple story with clear heroes and villains. That simplicity can be comforting, even when it is misleading. Older adults deserve better than rushed explanations. The brain processes information best when it feels safe and unhurried. When facts are shared calmly and placed in context, the mind has space to understand and remember. This is why trusted conversations matter so much. They interrupt the cycle of fear and replace it with steadiness. Understanding why myths spread easily helps us respond with compassion instead of frustration. It reminds us that confusion is not a failure of intelligence. It is often a response to uncertainty. When we recognize this, we can choose clarity over noise and patience over pressure. That choice protects both understanding and dignity as we continue this conversation together. Common Nipah Virus Myths. Seniors often hear many of the myths seniors hear about Nipah virus sound convincing at first because they are often shared with certainty. One common belief is that simply hearing about the virus means it is nearby, or that exposure is unavoidable. In reality, hearing about a virus does not place it in your community or your body. Information travels far more quickly than illness, and news coverage often focuses on possibility rather than probability. Another myth is that all viruses behave the same way. People may assume that if one virus spreads easily or causes certain symptoms, another will do the same. Nipah virus does not follow the same patterns as common seasonal illnesses. It has specific conditions under which it spreads, and those conditions are not part of everyday life for most people. Understanding this difference helps reduce unnecessary worry. I also hear concerns that any moment of confusion or fatigue could mean a serious infection. This belief can be especially troubling for older adults who already notice natural changes in energy or focus. Occasional forgetfulness, slower thinking after a poor night of sleep, or feeling mentally tired during stress are common experiences in aging. They do not automatically point to a rare virus. The brain responds to many influences, and most are far more ordinary than alarming stories suggest. Some seniors are told that doctors hide the truth or that medical guidance cannot be trusted. This myth often grows when information feels incomplete or rushed. In my experience, most doctors speak carefully because they want to avoid creating fear. Medicine relies on evidence, patterns, and time. Silence or measured language is not secrecy. It is responsibility. Another misunderstanding is the belief that learning facts will only increase anxiety. In truth, anxiety usually grows from uncertainty rather than knowledge. When facts are shared calmly and with context, they help the brain settle. Understanding what is known and what is not known gives the mind clear boundaries. That clarity supports emotional safety. I want to be clear that correcting myths is not about proving anyone wrong. These beliefs often form because people care deeply about protecting themselves and their families. That instinct is healthy. What helps is gently placing information back into proportion. When myths are replaced with balanced facts, the body relaxes and the mind regains trust in its ability to judge. For seniors, this matters greatly. The aging brain responds best to reassurance and steady explanations. When myths are addressed without judgment, people feel respected rather than corrected. That respect allows learning to happen naturally. By calmly revisiting common Nipah virus myths and setting the record straight, we create space for understanding instead of fear. This approach honors your experience, protects dignity, and allows you to stay grounded in facts that support peace of mind rather than disturb it. How fear changes the way the brain processes information. Fear has a quiet way of changing how the brain works, especially later in life. When the brain senses threat or uncertainty, it shifts its focus toward protection. This response is natural and human. It helped us survive earlier stages of life. Yet in modern settings, fear often comes from information rather than immediate danger. When that happens, the brain can become overwhelmed by signals it does not need to act on. In older adults, this protective response can affect memory and concentration more noticeably. Stress hormones rise when fear is present, and those hormones interfere with the brain areas responsible for attention and recall. A person may find it harder to remember details, follow complex explanations, or hold several ideas at once. This does not mean the brain is weakening. It means it is busy managing stress. I have seen many seniors who become more forgetful not because their memory is failing, but because they are anxious. When fear enters the room, clarity often leaves quietly. The mind narrows its focus to what feels urgent, leaving less room for reflection and understanding. This is why alarming headlines or repeated warnings can make people feel confused, even when the information itself is simple. The aging brain is particularly sensitive to emotional tone. Calm voices and steady pacing help the brain feel safe enough to process information. Rapid speech, dramatic language, or pressure to react can shut that process down. When seniors are told they must remember everything or decide quickly, anxiety increases and memory suffers further. The brain does better when it is invited rather than pushed. Fear also disrupts sleep, which plays a vital role in memory. Poor sleep makes it harder for the brain to organize information and store new learning. When worry follows someone into the night, the next day often feels foggy. This cycle can make fear feel justified when in fact it is the cause, not the result, of confusion. From a caregiving perspective, reducing fear is one of the most effective ways to support cognitive health. Simple reassurance, predictable routines, and gentle explanations lower stress and allow the brain to regain balance. When seniors feel emotionally safe, their ability to understand and remember improves naturally. Understanding how fear changes information processing helps us respond with compassion rather than concern. It reminds us that clarity grows in calm conditions. By choosing steady explanations and reducing unnecessary alarm, we support the brain's natural strength and protect both memory and dignity. What medical facts actually tell us. Medical facts are meant to guide care, not to frighten the people who hear them. When we step back from headlines and rumors, the core medical information about viruses becomes much simpler and calmer. Facts are built from observation, careful study, and patterns seen over time. They are not predictions about any one person's future. They are tools that help doctors plan protection and treatment. One important truth is that medical terms often sound heavier than they are meant to feel. Words like infection rate or severity are used to describe groups and trends, not individual outcomes. For older adults, it helps to remember that these numbers exist so healthcare teams can prepare resources and safety measures. They are not labels placed on any single body. Another basic fact is that exposure does not equal illness. Many viruses require very specific conditions to cause disease. The body has layers of defense that work quietly every day. The immune system responds in stages, often resolving challenges before symptoms ever appear. This process is especially important to understand because fear often assumes the worst, while biology is usually more patient. Medical science also tells us that context matters. A virus behaves differently depending on environment, timing, and individual health. Age alone does not determine outcome. Nutrition, rest, emotional stability, and early supportive care all influence how the body responds. This is why calm routines and steady support are so often part of medical recommendations for seniors. Doctors rely on facts to reduce uncertainty, not increase it. When we speak about risks, we are describing possibilities so that prevention can be thoughtful and measured. Facts allow us to focus on what helps rather than what alarms. They remind us that most care happens long before serious illness ever develops. From years of caring for older patients, I have learned that sharing only the necessary facts is an act of respect. Too much detail can overwhelm. Too little can confuse. The goal is balance. Clear, grounded information allows seniors to stay informed without carrying unnecessary weight. Medical facts, when explained gently, offer reassurance. They show us that healthcare is guided by evidence and care, not panic. Understanding these basics helps the mind settle and allows trust to grow. In that space, the body and brain can do what they do best, which is adapt, protect, and heal. Why doctors speak carefully about serious viruses? Doctors learn early in their training that words can heal or harm long before any treatment begins. When it comes to serious viruses, the responsibility of language becomes even heavier. Our role is not only to understand the science, but to translate it in a way that protects clarity, dignity, and emotional safety, especially for older adults. Careful language is used because medical words carry weight. A single phrase can linger in the mind long after an appointment ends. I have seen patients remember one alarming sentence while forgetting 10 reassuring ones. This is why doctors choose their words slowly, often pausing to consider how a message might be received, rather than how quickly it can be delivered. There is also an ethical responsibility behind this care. Doctors are trained to be accurate without being absolute. Medicine rarely deals in certainty. It deals in likelihoods, ranges, and evolving understanding. Speaking carefully allows room for that uncertainty without creating confusion. It acknowledges what is known while respecting what is still being studied. Another reason for measured language is trust. Older adults, especially those managing memory changes or heightened anxiety, depend on steady communication to feel safe. When a doctor speaks in extremes, the nervous system reacts before logic has time to respond. Calm wording helps the brain stay engaged and able to process information rather than retreating into fear. Doctors also speak carefully because language guides decisions. If information sounds urgent or catastrophic, people may feel pressured to act quickly or make choices they do not fully understand. Balanced language supports thoughtful decision-making. It gives families time to talk, reflect, and ask questions. This is particularly important in senior care, where routines and emotional stability play a major role in health. From my years of practice, I have learned that careful speech is not about withholding truth. It is about placing truth in the right frame. Serious viruses are discussed with respect, context, and proportion. We explain what matters most and leave space for reassurance. We focus on what can be done rather than what might go wrong. This approach also honors the body. The human body, even in later years, is not fragile glass. It is resilient, adaptive, and responsive to care. When doctors speak carefully, we affirm that resilience. We remind patients that knowledge is meant to support them, not burden them. In the end, careful language is a form of care. It reflects patience, responsibility, and respect for the listener. When doctors choose words with balance, they help create an environment where understanding can grow calmly. In that space, fear quiets, trust strengthens, and health conversations become something people can carry with steadiness rather than worry. This feels like a good moment to pause together, not to stop learning, but to take a breath and remember that you are not alone in listening to this. Health conversations can feel heavy, especially when they touch on viruses, uncertainty, or stories that have been repeated without care. Pausing gently allows the mind to settle and the body to feel safe enough to keep understanding. Over the years, I have learned that healing is not only about information, it is also about connection. When people feel part of a steady and respectful community, their nervous system relaxes, their thoughts become clearer, their questions feel welcome rather than rushed. This is especially true for older adults, and for anyone caring for aging parents or loved ones whose memory or confidence may already feel fragile. Senior Health Daily was created with this exact intention. It is meant to be a calm space where learning happens at a human pace. There is no pressure to remember everything. There is no expectation to react immediately. You are allowed to listen, reflect, and come back when you are ready. That rhythm matters more than speed. I want to take a moment to speak to you directly, not as a warning or an instruction, but as an invitation to stay connected. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. When you choose to stay part of this community, you are also supporting others who may be listening quietly, perhaps late at night. perhaps while caring for someone they love. Your presence helps create a shared sense of safety and dignity that extends beyond this single video. Community in health does not mean constant interaction. Sometimes it simply means knowing there is a place you can return to when questions arise or when information feels overwhelming. It means trusting that the conversation will meet you where you are, without judgment or urgency. As we continue, I invite you to carry this sense of companionship with you. Let the information unfold gently. Let your body remain at ease. Understanding grows best when it is supported by patience and emotional safety. This pause is a reminder that learning about health does not have to be lonely or stressful. It can be steady, respectful, and shared. How misinformation affects older adults differently. As we continue, it is important to talk about how misinformation affects older adults in a different and often deeper way. This is not about weakness or lack of intelligence. It is about how the aging brain processes information, especially when that information is emotionally charged or contradictory. Over many years of caring for older patients, I have seen how frightening or conflicting health messages can linger longer in the mind. The brain naturally holds on to information that feels threatening. With age, the ability to quickly filter and dismiss alarming messages can slow down, particularly when trust has already been shaken by changing headlines or inconsistent advice. What begins as a single confusing statement can quietly grow into ongoing worry. Older adults also tend to place a high value on authority and experience. When misinformation appears to come from a confident voice, a familiar platform, or a repeated source, it can feel credible even when it lacks context. This is especially true when messages are shared by well-meaning friends or family members. The intention may be care, but the result can be anxiety rather than reassurance. Another important factor is cognitive load. As we age, the brain works best when information is clear, consistent, and delivered at a steady pace. Misinformation often arrives in fragments. One claim contradicts another. New terms appear without explanation. For someone already managing memory changes, fatigue, or stress, this overload can lead to confusion rather than clarity. The mind may struggle not because it cannot understand, but because it has been asked to process too much at once. Emotional safety plays a large role here. Fear narrows attention. When people feel afraid, the brain shifts into a protective mode. Logical comparison becomes harder. Nuance disappears. This is why frightening health stories can feel convincing even when they are incomplete or exaggerated. For older adults, especially those with early memory concerns, fear-based information can linger and repeat internally, affecting sleep, mood, and confidence. I often remind families that repeated exposure to alarming messages can quietly erode a sense of control. An older person may begin to doubt their own judgment. They may withdraw from conversations about health altogether, not because they do not care, but because the topic feels overwhelming. This withdrawal can be mistaken for denial, when in truth, it is a form of self-protection. Understanding this difference matters. It reminds us that clear and calm communication is not a luxury in senior health. It is a necessity. When information is shared slowly, with context and reassurance, the aging brain can do what it has always done best. It can reflect, connect meaning, and integrate knowledge into daily life without distress. Recognizing how misinformation affects older adults differently helps us respond with patience rather than frustration. It invites us to replace urgency with clarity and fear with steady explanation. This approach protects dignity and supports mental well-being, which are just as important as the facts themselves. Emotional safety as a form of health protection. Emotional safety is often overlooked when we talk about health, yet in my experience, it is one of the strongest forms of protection the body has. When a person feels safe, the brain can rest. When the brain can rest, it becomes better at understanding, remembering, and making sense of information. This is especially true for older adults. I have seen many patients whose physical health was stable, yet their symptoms worsened during periods of worry or disruption. The body listens closely to the emotional environment. When days feel rushed or unpredictable, the nervous system stays on alert. In that state, new information can feel heavier than it truly is. Even accurate medical facts may sound threatening when the mind is already tired. A steady, daily rhythm helps protect emotional safety. Simple routines like waking up at the same time, eating familiar meals, and resting regularly give the brain clear signals that life is manageable. This sense of order allows the mind to process information more carefully rather than react to it. When routines are in place, the brain does not have to spend energy on constant adjustment. That energy can instead support understanding and calm reflection. Sleep also plays a quiet but powerful role. When sleep is disrupted by worry, the brain becomes more sensitive to fear-based messages. I often notice that patients who sleep poorly are more likely to fixate on alarming health stories. With proper rest, the brain regains its ability to sort what matters from what does not. Emotional safety at night supports clarity during the day. Emotional safety also grows from the way information is shared. A calm voice, familiar language, and respectful pacing help the brain stay open. When people feel rushed or pressured to respond, understanding narrows. When they feel invited to listen without urgency, understanding expands. This is why gentle conversations often lead to better comprehension than forceful explanations. For older adults, emotional safety protects dignity. It allows questions without embarrassment and reflection without judgment. When people feel safe, they are more willing to say they do not understand yet. That honesty is the foundation of true learning. It prevents misinformation from taking root because the mind feels free to pause and ask. Families and caregivers can support this by choosing calm moments for health discussions. Not everything needs to be addressed immediately. Sometimes waiting until the environment feels settled makes all the difference. A quiet room, a familiar routine, and a patient tone can turn confusing information into something manageable. Emotional safety does not remove challenges, but it softens their impact. It gives the brain space to work wisely rather than defensively. In this way, emotional safety becomes a form of health protection, guarding not only the mind but the whole person. How families can help calm the noise. Families play a quiet but powerful role in helping older adults feel steady when health information becomes overwhelming. Over the years, I have learned that calming the noise does not mean hiding information or correcting every detail. It means creating an environment where understanding can grow without pressure. One of the most helpful things a family can do is slow the pace of conversation. When many opinions arrive at once, especially from television, phones, or well-meaning relatives, the brain can feel crowded. Older adults often need a little more time to sort through what they hear. Giving space between conversations allows the mind to settle. It tells the nervous system that there is no urgency to react. Listening comes before explaining. When a loved one shares a concern, it helps to let them finish without interruption. Even if the worry seems based on a misunderstanding, being heard reduces tension. Once the emotional charge eases, the brain becomes more open to gentle clarification. I have seen many moments where simply listening calmly changed the entire direction of a conversation. Respecting independence is also essential. Older adults have a lifetime of experience making decisions. When family members rush to correct or dismiss concerns, it can unintentionally create resistance. A more supportive approach is to ask thoughtful questions and explore information together. This preserves dignity and reinforces trust. Choosing reliable sources as a family can reduce confusion. Rather than reacting to every new headline, families can agree on a few trusted places for health information. This shared agreement helps limit repeated exposure to alarming messages. It also creates a sense of teamwork, where everyone feels protected rather than pulled in different directions. Routine is another quiet stabilizer. When meals, rest, and daily activities remain consistent, the brain feels grounded. Families can help by protecting these rhythms, especially during stressful periods. A familiar routine sends a calming message to the nervous system, making it easier to process information with clarity. Tone matters as much as content. A calm voice, gentle eye contact, and unhurried posture signal safety. When families speak slowly and with reassurance, the message reaches deeper than words alone. The brain listens not only to what is said, but to how it is said. It is also important to know when to pause. Not every question needs an immediate answer. Sometimes it is enough to say that we can revisit the topic later. This gives the mind permission to rest. Rest is not avoidance. It is preparation for better understanding. Families who help calm the noise protect more than mental clarity. They protect emotional well-being and self-respect. In that calm space, older adults are better able to reflect, ask questions, and make sense of health information at their own pace. This kind of support strengthens connection and reminds everyone that understanding grows best where patience and respect are present. Replacing myths with steady understanding. Replacing myths with steady understanding is not about learning everything there is to know. It is about learning enough to feel grounded and at ease. Over many years of caring for older adults, I have seen that peace of mind rarely comes from collecting more facts. It comes from knowing which information truly matters and which can be set aside. Myths often take hold when the mind feels rushed or uncertain. They promise simple answers to complex situations, but they usually increase worry rather than reduce it. Steady understanding works differently. It moves slowly. It respects the natural rhythm of the aging brain. It allows information to settle without demanding an immediate reaction. When we replace myths with calm clarity, the body responds. Breathing becomes easier, sleep improves. Attention returns to daily routines that support health. The nervous system feels less threatened, which helps the brain organize thoughts more clearly. This is especially important for older adults, whose brains may need a little more time and reassurance to process new information. Understanding does not require memorizing medical terms or statistics. It means recognizing what is true, what is uncertain, and what does not need immediate concern. In my practice, I often reminded patients that it is perfectly acceptable to know just enough for today. Tomorrow can bring more learning if it is needed. There is no prize for carrying unnecessary worry. Steady understanding also protects dignity. Older adults deserve information that empowers rather than overwhelms. When myths are gently replaced with context, people regain confidence in their ability to think clearly and make decisions. They feel respected, not managed. This sense of autonomy supports emotional health and strengthens trust in the caregiving relationship. Another quiet benefit of steady understanding is improved communication. Conversations become less reactive and more thoughtful. Families and caregivers notice fewer arguments and more shared reflection. When fear is no longer driving the discussion, curiosity can return. Curiosity is a healthy sign. It means the mind feels safe enough to explore. It is important to remember that understanding is not a one-time achievement. It is a process that unfolds over time. Some days the mind feels clear. Other days it feels tired. Both are normal. What matters is having a stable foundation of trustworthy information that can be returned to when needed. By letting go of myths, older adults free up mental space for what truly supports well-being. Relationships, routine, rest, and meaningful moments regain their place. Health information becomes a tool, not a burden. In this steady approach, knowing enough is more than enough. It allows life to continue with calm awareness and self-respect. That is the kind of understanding that supports not only health, but the dignity of the aging journey itself. Thank you for staying with me all the way to the end. I know that choosing to listen, especially when the topic touches on health and uncertainty, takes quiet courage. Today, simply listening and understanding is enough. There is nothing you need to change right now. There is nothing you need to fix. You do not need to carry this information any further than feels comfortable. As a doctor who has spent decades caring for older adults, I want to gently remind you that medical knowledge is meant to guide, not to weigh you down. When information creates tension or fatigue, It has lost its purpose. True understanding should feel steady. It should give you a sense of direction without demanding urgency. If at any moment this conversation helped you feel a little calmer or clearer, then it has already done its job. Senior Health Daily exists for moments exactly like this. It is a place you can return to whenever health information feels too loud, too fast, or too confusing. There is no pressure here to keep up or to remember everything. You are always welcome to pause, to reflect, and to come back when you are ready. Aging is not a problem to be solved. It is a journey that deserves patience and respect. Your body and your brain have spent a lifetime adapting, healing, and learning. They continue to do so best when treated with calm understanding rather than fear. Trust that wisdom. Trust your ability to take in only what you need. I'm grateful for the time you shared with me today. We walk this path together, steadily and with dignity. Whenever you need a quiet voice and thoughtful guidance, Senior Health Daily will be here, ready to listen with you.